Hello everyone, this is Dr. Shushma Sarala, consultant homeopath and clinical nutritionist at Fidicus Homeopathy. Now let's note the types of endometriosis. Ovarian, superficial peritoneal, deep infiltrating and extraperitoneal. So what is superficial peritoneal endometriosis? Remember that if there is endometriosis near your peritoneal area, especially in the pelvic region, it is called as superficial peritoneal endometriosis, where the endometrial tissue is lodged near your pelvic region of your peritoneum. So what is this peritoneum? See, the body is enclosed, or the abdominal cavity is enclosed in a sheet called as peritoneum. So whenever the endometrial tissue is lodged near the peritoneum, near the pelvic area, then that is called as superficial peritoneal endometriosis, which is very common type of endometriosis. Then coming to your ovarian endometriosis. So what is this ovarian endometriosis? Whenever the endometrial tissue, this is the uterus, this is the fallopian tube, and this is the ovary. So whenever the endometrial tissue is traveling either to your fallopian tubes, this area, or to your ovaries, this area, then that is called as ovarian endometriosis. See, remember, in superficial peritoneal endometriosis or an ovarian endometriosis, in any kind of tissue, when the endometrial starts bleeding because of the hormonal balance or normal hormones that are running through your body, then that will cause bleeding because the blood cannot go anywhere else. It is lodged, or it is packed in a scar tissue called as fibrosis. If you can see here, these white bands are called as adhesions. So whenever your endometrium is bleeding, the blood cannot go anywhere else because it is not inside the uterus, and that blood pooling will cause the body to tell that you have to stop it here itself. So it will cause adhesion or scar tissue formation. So these white bands you're seeing are the adhesions. Next kind of endometriosis is a deep infiltrating endometriosis, where your endometrium is not only lodged in your fallopian tubes, in your ovaries, but also near your intestines. As you can see, the blood spotting. Wherever there is blood, then there is endometrial tissue there. So what happens if there is adhesions or fibrous bands formation? Remember, your body is going through peristalsis for your food from your mouth to your anus, where the food is metabolized. So it is going through a process called as digestion through the process or through movements called as peristalsis. Whenever there are adhesions, there is no movement at all. So there will be certain problems related with endometriosis. That is why you will have painful defecation, or if it is lodged somewhere near your urinary bladder and there is adhesion near your urinary bladder, and that will cause dysuria or painful urination. And because of the adhesions, it can also cause dyspareunia or pain during the intercourse. Next, extraperitoneal or extraperitoneal endometriosis. Remember, as I already taught you, or I already told you in the pathology part, when there is angiogenesis in the endometrial layer, because the formed capillaries are not so strong or proper, or due to other causes, the endometrial tissue is lodged in the blood capillaries or in the lymphatic system. It can travel anywhere into your body. So this anywhere can be either your lungs or your diaphragm or anywhere else. Wherever the blood is traveling, sometimes it will deposit the endometrial layer. So it can deposit in your lung, or it can deposit in your diaphragm. It can deposit anywhere in the body. Then this is called as extraperitoneal endometriosis. Coming to the classification of endometriosis. First one, stage 1 is minimal. See, as I told you in the starting, that 25% of people suffering from endometriosis do not have like very effective or very strong kind of symptoms, or very maybe no symptoms at all. Then that is called as minimal endometriosis, where the endometrial tissue is lodged very superficially, maybe one or two sites, just that, and there is no severe pain or severe dysmenorrhea. Coming to your mild sort of endometriosis, here you will see that the sites of endometrial lodging or placement are more than the first one or stage 1, and you can see dysmenorrhea as well as starting stages of not being able to get or not being able to conceive, which is fertilization issues, can also start in your stage 2. Stage 3 is called as moderate endometriosis, where there are multiple sites of lodging of endometrium, severe pain in the menstruation, chronic pelvic pain, that is, you will have pain in your hypogastric region or in your lower abdomen, regardless of your menstruation. Like even if you're menstruating, even if you're not menstruating also, you will be having sort of dull or maybe severe sort of pain in your pelvic area. That is called as chronic pelvic pain, which can be seen in a very milder form in stage 2 but prominent in your stage 3. There will be severe form of dysmenorrhea. You will have fertilization issues, and not only that, you might also experience hematuria, blood during your urination, dyspareunia, which is pain during intercourse, and also dysuria, painful urination as well. And also you might experience associated symptoms like diarrhea as well as constipation, and also not only that, you will have pain. Some people experience pain even while defecating. Stage 4 is a severe form of endometrial or endometrial lodging or placement, where it is placed everywhere or multiple sites in your body. Multiple sites are bleeding, severe form of pain, no fertility, or the person is not able to conceive at all. There is pain always in the body, and not only that, extraperitoneal lodgings or extraperitoneal placements of endometrium are also seen in stage 4. Now coming to the consultation part of the Fidicus Homeopathy. If you're suffering from endometriosis and you would like to visit us, then remember that we have two kinds of options. One is the online consultation option, where you can contact us even if you're staying far away from the nearest branch of Fidicus, through audio or video call consultations. And if you're staying near the nearby branches of Fidicus Homeopathy, then you can come in person and contact us. Remember, you can contact us either through WhatsApp or through call through this number. If you're consulting us online, then remember, if you're having any sort of investigations which are related to the present symptom, that is endometriosis, you can share it with us and we will let you know if we need further investigation. Not only that, and don't you feel that you have to buy medication from somewhere else. Here at Fidicus, we offer you with top rated medicines which are delivered to your doorstep. If you're staying in India, then it will take about 3 to 4 business days. If you're staying in USA, 3 to 5 business days. And apart from that, it can take up to 4 to 8 business days for the medicine to reach you. You can contact us here at Fidicus through this number. You can contact us either through WhatsApp or through call. If you're suffering from endometriosis, then why should you choose Fidicus, or why would you want to associate with Fidicus Homeopathy even though there are a number of homeopathic doctors near you? The reason is that here at Fidicus, it is highest chances of success as well as health. We give you top rated, best quality medications, and the patient care or the personal care that we give here at Fidicus is of top notch. And not only that, the transparency in treating the patient is also there. And also we have highest success rate. So next time if you want to choose homeopathy, try choosing Fidicus Homeopathy. Thank you.